I like to have him along. He is also a city commissioner for Garnett and soon to be our mayor. And he'll talk to you a little bit from that perspective as well. So again, Mike Burns, President and CEO of Auburn Pharmacy. We have pharmacies across Kansas and Missouri. I bought my first pharmacy at the age of 25 back in 1992, Garnett, Kansas. Why? Because I wanted to take care of patients my way. I worked at the pharmacy in Eudora all through pharmacy school. I got out, worked for Kmart for a year and a half. I learned some things operationally. They were doing some neat things, but as far as patient care, they weren't doing things the way the big chains didn't do it, how I grew up and how I wanted to do it. So went to Garnett, bought my first little store. Back then, 30% of our business was what we call third party. 70% was cash. That's where the patients got to choose their pharmacy based on location, convenience, service, and price, because 70% of you were paying out of pocket. Med D had not came along yet. That didn't come along until about 2004 and 2005. You all probably remember those days. I'm going to talk a little bit about, where we got today. First of all, can everyone hear me?
Yes.
Okay, because then I can walk around. I tend to talk loud anyway. But talking about PBM reform, let's go all the way back to the 1990s. Back in the 1990s, as you all remember, we didn't have prescription drug insurance. We barely had Medicaid to pay for prescriptions. But then as medication became a larger and larger part of how we delivered health care, then employers who provided health coverage for their employees and insurance companies felt like it was probably the right thing to do is to start providing some coverage for prescriptions. And we're probably going to go up here and just going to start on the screen. I'll get to that here in a minute. So, but if you think about it back then, I remember, my mom and dad shared in Elmwood. My dad was a lumber salesman and had Mid-American Lumberman's insurance. And so at the end of the year, they would take our receipts and send them in and get 80% back. Remember those days where you didn't have any prescription drug insurance? Well, that was a lot of work. You can imagine your insurance companies and your payers trying to handle all those receipts and all the reports and everything coming in. So then someone came up with the idea, just like when you were going to bill for, when you went in for an office call, you would pay your office visit and then the doctor's office would bill your insurance company. That process was already in place and set up, but there was no process for how the pharmacy would bill the insurance company for the prescriptions you got, where you would only pay your copay and then they would bill the payer. That's where a pharmacy benefit manager came into play. They came in and said, you know what, we're going to have a way where they started a contract with the local pharmacies. They came in and said where they were representing Goodyear, General Motors, Frito-Lay, think of some of your larger employers up in this area, and other insurance companies, said, if we go contract with the pharmacy and get the pharmacy to agree to accept a certain level of reimbursement, the other big deal is they asked us to do the paperwork. That was the big deal, okay? They said, but Mike, if you're going to take care of these patients, at that point may have been 1 or 2, 3% of our business, but then we had to fill out the paperwork. We would charge you the copay. We'd fill out the paperwork. Then we would take the forms. They were paper at the time. We would send them in waiting to be paid. That's how it all started. And it made sense. Okay. We needed to have someone there to help streamline and bring efficiency to determining benefits, who had benefits, who didn't, what your portion was to pay, and then what the employer or the insurance company was to pay. So that's where then, yes, the pharmacy benefit manager was born. From that, then they got, yeah, you could back up just a couple of screens, but so then, I'm gonna walk around just. Yeah. So then we, as they got more and more business, they would come in, and so then they realized, you know what? The payer over here has no idea what we're paying the pharmacy. We have a contract with the pharmacy that they don't know about, and in fact, our contracts today prohibit me from sharing anything about the reimbursement in certain terms with the employer or the insurance company is paying. Isn't that nice? We call those gag clauses. Okay, they don't want me to tell an employer that the employer is paying more than I'm getting paid, and there's a spread in the middle. So once the PBMs recognize that they're in a unique situation where they're contracting with the pharmacies, but the payers don't know what you're paying the pharmacies, so they started reducing what they're paying the pharmacies. At the same time, they're telling the employer and the insurance company they're paying them per claim to handle the claim, thinking that's all they're paying. So your pharmacy benefit manager handling the pharmacy benefit was getting paid per prescription, per claim to help set all this up. Then they also were getting the spread. They were paying me less than what they were billing the employer. It's a nice position to be in. Also under contract, I can't tell the employer what's going on. Then, as they grew, they got bigger and bigger. There were more and more PBMs that came on the scene because there was a lot of money. Then they also found themselves, they realized, you know what? We're the ones that get to determine which medications are covered, which ones aren't, and what you as a patient pay for those prescriptions. And again, the employers weren't really aware of all that was going on, but so then they went to the manufacturers and said, if you want your drug covered, which who wouldn't, we're going to ask that you give us a small rebate back. I call it a kickback. They call it a formulary rebate. I want a kickback, or I'm not going to cover your drug. Well, those started out maybe 5–10%. So now they're getting the per claim fee to manage it. They're getting the spread pricing in between what they're charging the employer and what they're paying me. Now they're going to the manufacturer and getting a big kickback. This went on to the point where today, 98–99% of prescriptions are all processed through a PBM in some way. And there are 3 PBMs that control 82–83% of the business. That is an oligopoly, but it is working today like a monopoly. The PBMs got so wealthy, they went out and bought the biggest insurance companies. Have you ever seen a PBM go out of business? First of all, it's interesting that today a lot of people don't even know what a PBM is, and they're 3 of the 16 largest companies in the country, and they don't even know who they are. But I'll bet you know who United Health is, though. Okay, well, United Health now has aligned themselves with Optum, one of the 3 largest PBMs in the world, in the country. We'll talk about that in a minute. We also have Express Scripts and Cigna. Okay, everybody's heard of Cigna, maybe not Express Scripts, but they're out of St. Louis, Missouri. They are really one of the biggest. And then we have CVS. Okay, well, CVS has Caremark, and they also now own Aetna. So you have the 3 largest health insurance companies and the 3 largest PBMs who have their own pharmacies, whether they have the CVS retail pharmacies or they have their mail order and their specialty pharmacies. That, ladies and gentlemen, is a monopoly. That is not a free market. That's not good for you, and it's not good for me. And it's not good for the taxpayers. I'm going to talk a little bit more about that. Do we have this where I kind of start rolling through there? Okay. So, kind of as a backdrop, I always want everybody to know, how in the heck did we get where we were at? And then they would say, but Mike, why would you sign those contracts? If those contracts are to the point where they're paying you less than what you pay for your medications. Today, over 30% of all prescriptions that we fill at Auburn Pharmacy, we get paid less when I pay for the medication. How am I supposed to pay this man? And when you come into a pharmacy and you need help right away, you appreciate having that pharmacist. Where they want to try to push everything to their mail order, to their specialty, what we call affiliated pharmacies, where we have found and proved that they pay their own pharmacies sometimes 10, 20, 30 times more than they pay us. Isn't that nice? Guess what? I'm not supposed to talk to you about that. Okay? Remember those gag clauses? I'm not supposed to know it, and I'm not supposed to talk about it. But ladies and gentlemen, if I don't, our pharmacies are going to continue to close. Last year, we had 10 or 12 pharmacies here in Kansas closed, never to reopen. We're probably going to have another 10 or 12 closed today. There's thousands of pharmacies closing across America every day. It is unsustainable. And so when we think about Nate and I on the drive up here, we're talking about some things. And also, I mean, no one understands more than us how how important it is for you all to have access to a pharmacist where you can call on the phone and speak to them or walk in and talk to them face to face. Sometimes we do have challenges in dealing with technology. Okay, I'm about to turn 60. Sometimes I turn my phone over to my daughters and I'm like, just do it. Okay, I get it. But just imagine if you didn't have a local pharmacy to go to. Okay, if you can't get a hold of your cable company to figure out how you can watch the Royals this afternoon, which is a big deal, but that's not going to impact your life too greatly. But if you can't get a hold of a pharmacy or you can't get access to your needed medications, that is life threatening. And that's happening every day. So first, it was the very first screen. So here's what this is kind of complicated. Come back to there's no way you're going to be able to see it. But what we have here is we have the pharmacy, we have the pharmacy benefit manager, we have the manufacturer, and we have the wholesaler. And somewhere involved in there is you, the patient. And we believe that you're one of the most important parts. But unfortunately, that gets overlooked a lot in this whole system now because it's really all about making money for the insurance companies and the pharmacy benefit managers. Again, I can give you the printouts if you want to go look at them. You're going to have that saved so you can print those for them. Next screen, please. All this does is it talks about the consolidation. If you can't see from back there, we've got starting back in 2000, pretty easy to see how many pharmacy benefit managers we had. And this was only the major PBMs, okay, because there was about 400 at one time. That was in 2000. You go to 2006, you go to 2012, 2018, look at 2021, look at what we got. The FTC allowed this to happen. We need our state to step in and help. Just because it's a federal, they say it's a federal issue, federal needs to fix it. Ladies and gentlemen, you're here for a reason because you're very involved in politics. I spent more time in Washington, D.C. the last 10 years than I care to admit. Well, things don't happen quickly. It's tough to get things done up there. Here, we can make a difference locally. We can make changes, but we have to have people advocate for that. We need people like you to step up and recognize we have a problem. And we're going to hold our legislators here in the state of Kansas to fix it for all of us, for the taxpayers, the employers, and the patients, and yes, the providers. I may sound like, I'm just a pharmacist up here crying because I want to make more money. Ladies and gentlemen, I'm struggling to keep our pharmacies open. About a year and a half ago, one of our competitors who used to work for us, Nate Rockers and Paola, just abruptly closed the doors. Okay, right down the street from us. Okay, we're not uniquely different than Nate. We're still hanging in there. We're trying not to go anywhere, but it's not easy. We need PBM reform. We need our Kansas legislature to step up and force what we call transparency. We need to do away with spread pricing. Why should the PBMs be taking all the profit, trying to put the pharmacies out of business? Guess what happens when they put me out of business? You get fewer and fewer options, which does what? It forces you to their affiliated pharmacies where now they can charge what they want behind the scenes. They can also send you to their specialty pharmacies. I'm going to show you my personal experience about specialty pharmacy, what it did to me as a patient and what it did to me as an employer. And then it also sends you to mail order. Now, sometimes mail order, I'll admit, can be awfully convenient. I am an Amazon shopper. I put it in and all of a sudden, seriously, it shows up at my doorstep. But healthcare, you can't always do that. Okay. So mail order pharmacy is not always your option. Specialty is not a good option. You need to have access to a local pharmacy. But this exemplifies what has happened about the consolidation. Does that not scare you? Because you don't realize what's happening, but it's increasing costs for everyone. But they will tell you, oh, good thing we're here. Good thing, especially the PBMs, good thing we're here. We're helping control costs. And I say, you know what? You sure are. That's right, for yourself. It's self-dealing. But you're not really saving money. You're adding cost to the system. Talk more about how that happens. Next screen. This just tells you a little bit more about the consolidation. You've got CVS Caremark there, 34%, Express Scripts, 23%, Optum, 22%. Then you got Humana, MedImpact, and Prime, which Prime then had jumped on to Express Scripts last year, taking them. So that's all we've got right there. Those are your major PBMs. That's it. But you look at the three that control the vast majority of it, and that's where we're the problem. And then you go through here, they've got all the specialty pharmacies in there, but we'll go to the next slide, please. Okay, now here's where I'm going to talk a little bit about what they do. and I wish this was more clear, but if what you can see in here is cancer drug for a 30-day supply. I'm just going to jump to my personal experience because I think it'll explain what's going on here, where you can see, all you got to see here is local pharmacy, $125. Okay, see the PBM and mail order, the 1,500. That should infuriate you. That happens every single day. Let me tell you about me. A few years ago, I got told those 3 words. So now here I am, I'm visiting with my doctor, my team. I'm setting up my treatment between my radiation, my chemotherapy, my IV, and my oral. So I get my prescription for capecitabine. Next screen, please. Okay, right there it is, sitting on a shelf. So I go to the pharmacy with my prescription, going to fill my own prescription. Now here I am, I'm the patient, but I'm also the pharmacist, and I'm a pharmacy owner, but I'm also the plan sponsor, meaning the business owner who now is responsible for putting together the healthcare plan to provide healthcare for my employees and prescription drugs for my employees, including me. So here I go to fill my prescription. I get it down, I send it through. You see what happened to the pharmacy there, and there I input it. Guess what? It comes back rejected. Specialty pharmacy only. Now I'm under contract at the time with Optum. I was with Blue Cross Blue Shield, fully insured company. We had insurance with Blue Cross. They were using Optum as a PBM. Now already, even though this was 5 or 6 years ago, I already knew what was going on with the PBMs and how much they were gaming the system. But I said, you know what, now I'm going to get to see this firsthand. So I send the prescription in, send it in to the specialty pharmacy, which happened to be in Kansas City. By the way, you know who gets to determine what specialty? PBM. Mm-hmm. Why is it special? They say because it's high cost and it's a more complex therapy requiring more monitoring and oversight and management of you and your healthcare because it's a specialty drug. So let me tell you what they did when they took this specialty drug where I couldn't fill it off my shelf and made me get it through the specialty. Okay, next slide. You can't see this. This is what we call an EOB, an explanation of benefits. You all get that. Probably, you know, when you go to the pharmacy or go to the doctor, it says, hey, here's the allowed amount. Here's what you paid. Here's what the plan paid. Well, this is what I got. What I did, just slide forward a couple. You're not going to want to go through these, but it's all right there in detail. When I added it all up, I had to take 2 strengths for 6 months. That's 12 prescriptions. Guys, if we can make 15 to 20 bucks a prescription, we're feeling pretty good. We can keep our doors open and make sure and take care of you. So across 12 prescriptions, okay, you're looking at about maybe a couple $100. Let's even say $300. Let's go to the next screen. Okay, somehow we've zoomed in. If you can zoom out. Okay, here's what this is going to tell you. Okay, the final numbers. I'm just going to read them off to you. The final numbers are this. My cost after all rebates and everything for the 6 month of therapy would have been $2,600. Now remember, if we could have made $300, a little bit on each one of them, we'd have been pretty happy. That makes $2,900. What do you think happened when they made it go specialty? Do you think they charged $2,900? Now, if they're there to help control costs, and God knows they're probably buying better than we are. Okay, but I'll tell you, Auburn, we buy more pharmaceuticals in Kansas, and still, I'm pretty sure they bought better than I did. So then what they did is they billed the plan. Now this is just billed amount, not allowed amount. They billed the plan $54,000, which is absurd. Mm-hmm. But they still allowed $15,300 that got billed to my plan instead of $2,900. So think about that. That's about a $13,000 extra markup. Yeah, I see look on your face. It happened. And this happens thousands, if not tens of thousands of times every day in our country. And you wonder why prescription drug prices are going up, and you wonder why healthcare costs are going up. Ladies and gentlemen, our middlemen are driving the prices up for their own benefit, and you right now, if we don't get PBM reform, we can't do anything about it.
Can you restate that? Did you just say $13,000 markup?
Extra markup, yes, and I will give you the documentation to prove it, okay? So yes, I was not happy. So I decided at that point, yes, that's a 4,000% markup, something crazy like that. Okay, and again, because it's more complex therapy, you know, not one time did I get a phone call from that pharmacy asking Mike Burns, how you doing? Got any questions? Not once, not one time. Okay, so when they talk about specialty pharmacy from a pharmacy benefit manager, I want you to understand this is what they're doing. They're sending you to places they won't let you come to your local pharmacy. In fact, some of the manufacturers won't even sell to your local pharmacy because the PBMs have it set up to go through their own specialty. So why even sell it to Auburn Pharmacy when no one can come to me and get it? You should be able to, but you can't. So I embarked on a strategy. I said, you know what, I'm really upset. I realized I get to get away from the PBMs because I realized what happens when they bill your plan for higher costs the next year. What do they do to your insurance premiums? They raise it. So think about this. How nice is that? Just on one drug, they got to make an extra $13,000 only for the right to come back to me next year and say, hey, Mike, you spent a lot of money. We got to raise your insurance premiums, making even more money. That's what's been happening. I can't be any more clear than that. I hope you all can understand what I've just explained to you. And it happens when they send this to mail order as well. They tell the employers, if you go mail order, it's going to save you money. Remember, the employers don't get to see what I'm being paid. We're starting to lift a skirt on that. Okay. We're to the point now where I don't care. You have to see what I'm not being paid. There are prescriptions, and Nate's going to talk a little bit about this, the things that we have to do today. We never thought we would ever have to think about not being able to take care of a patient because we can't sell a prescription that costs us $1,000 and get paid $800. That's what's happening. There are prescriptions where we, in fact, if you'll jump to the next screen. Okay, play this real quick. I'm going to see if you all, I want to watch my time, Nate, make sure I stay on. Okay, 1:26, we still got a lot of time. Okay, go and see if you can play this.
Most Americans have heard of the most Americans have heard of the news and with their friend years ago until like there's a big into this industry. Everybody's either be so or business strictly. They have a lot of money. That's what this is. This is like America's PBMs are strong. They're powerful. A lot of money and they spend on it. The United States is the hottest drug process in the world. The United States only country.
Do you able to hear that?
Explaining
We can sort of,
prescription
but
drug prices.
Internet choppy or something.
Okay, we'll just,
It's pretty simple.
this is a dear friend of mine, Dan from Wisconsin.
Are inflated.
And he has been working real hard. His daughter actually is in the film business. So he went to her and said, honey, you need to help me. We need to start putting together some films and videos out there to try to explain to the American public what's going on. I have 3 of these clips in there. I would share, you've got the file, you can keep my flash drive. If she'll give it to you, go home, if you can copy, share, whatever you do, play those videos. It'll also take you to a website where there's tons of videos that helps explain what I'm talking to you about in pretty plain language, okay? But it talks about the different things that have been going on in the country. So let's jump to the next screen. And remember what's coming up next year. Okay. Oh, these are just copies. These are actually, they're getting a little bit faded here. There we lost $1,066. There we lost $34.31. That one we lost $100. Those are actually what we look at when you come in. You don't get to see this. We're back here filling your prescription, taking care of you. What you don't realize is we're taking a look at this and saying this is not sustainable. Okay, we're getting paid less than what we pay for the medication, not to mention our operational overhead. And this is real. It's real. It's not a lie. This isn't just pharmacies begging for, they want to make too much money. We're just trying to stay here for you. Okay, next screen. It might be another. Okay, here's what I did when I cut the middleman out. I said, you know what? I have the ability, but I'm very unique. I've got a group of pharmacies. I'm a pharmacist. I understand the game. I said, you know what? I'm going to cut you out. I also paid my pharmacy fare at $15 to $20 per prescription. Okay, when one of our employees goes into one of our own pharmacies or their family goes into our pharmacies are being reimbursed fairly. Okay, why would I want to rob from Peter to pay Paul, right? One pocket to the other, so we're going to pay fairly. And then, but we cut the PBM out. Okay, so now, they're not doing the spread pricing. And then, yes, then I got to participate in those rebates, put those back in where I can help lower my costs. What I did, and does anyone know on average what healthcare costs go up per year? Okay, right now it's averaging about 12%. Some reports say 9%. I've seen a lot of folks come to me and they've increased 16, 18%, 20%. What I was able to do, and this is why this is important, because the PBMs and the large insurance groups, these big 3 groups will tell you that if there's reform, costs are gonna go up. They don't want people to know that if they're cut out, we can still deliver excellent healthcare and actually save money. What that is going to show you is 21, 22, 23, 24, 25 is not done. But if you showed 18, 19, and 20, okay, you see where those are relatively flat? That's what Auburn Pharmacy pays for our health insurance. How in the heck did I do that? How did I keep my costs flat across the last 4 years? And we've also increased benefits to our employees at the same time. We've offered an HSA, we've offered a buy-up plan. We've been able to actually increase the insurance benefits that we provide to our employees at the same time, keeping it flat. The only way we do it is I cut the PBM out. But guess what? How hard is that for other employers to figure out? They don't know what I know, and when the brokers come in, which I'm gonna make, I'll tell a little bit about the city of Garnet. I'm gonna make some topic.
Okay. In the frame?
Yeah,
Camera?
yeah, that's good.
So when I got elected as city commissioner, knowing what I know about PBMs, I went to our city manager and our HR manager for Garnet, and I said, we need to evaluate a transparent PBM model. We need to look at carving out Optum, because that's who our PBM, United Healthcare Insurance with Optum as the PBM. And the first year, we requested data so we could evaluate what we're spending on the pharmacy benefit. And our broker didn't reply to the request. And we'd asked again, they didn't reply, and then before you know it, it's time for renewal, and we just have to roll with a typical renewal, fully insured. This year comes around, and I started a little bit earlier, and I made the request. Told it's not a lot of data, just we need 5 pieces of information. Don't need any identifiers. We don't want to know who's getting the prescriptions or who's, where the dollars being spent on whom. We don't want to know that. We just want to know how much is being spent, where the money's going. And our broker came back with a reply this year and said, you don't want to do that. And I realize the city of Garnet doesn't have a ton of employees. It may not be in our best interest to pursue a partially self-insured or fully self-insured option with about 60 employees. But it's our decision whether we do that or not, and they're withholding the information we need to make that choice. And the reason for that is because the brokers are also involved with the PBM scheme in managing benefits. So when you're presented with information as an employer, the cards are already stacked against you when trying to make informed decisions, because the information that you're getting is what they want you to see.
That's really the point. Thanks, Dave. And employers run into this every day, trying to get to the bottom line, trying to figure out, again, what would be my expenses if I could see, where all the prescription drug, where it all went. They're not allowed to see that. So what happens is the brokers who involve, and I guess everybody's got to make a profit. I'm not against that. But the brokers, obviously, they have money at stake. If this were to start to go away or the onion be peeled back, they're going to make less money. Because that's going to get shared back with the employer, which gets shared back with the employees, lowering what you pay, lowering your co-pays, right? Lowering everybody's costs. But they tell employers, you don't want to do that. And employers are unable to say, well, yeah, but I'd like to know if I had a transparent program, pharmacy benefit, and self-funded last year compared to what I did with you, what would that look like? Well, the only way you can know that is if you get to see last year how much you spent on healthcare and where it went, right? Where the costs were. You're never going to get to see that. Because then you'd be able to compare and go, look at all that extra money. But they're not letting you see that. So next slide, because the other thing I want to talk a little bit about, okay, is right here, all of the settlements to tell you the behavior of these PBMs and the things that they get away with. There's not an industry that I know of that continue to lie, cheat, and steal. Yes, I said it, and get away with it. They write checks for settlements out of court and keep doing business as usual. In 2021, Derek Schmidt, I've known Derek for a lot of years. He, as Attorney General, went after Centene, who was administering the Medicaid program, and found that they were overbilling, undercharging, not reporting correctly. And they wrote a check for 27.6, it's on here somewhere, 27.6 million. It's a lot of money for the state of Kansas. That's only one PBM, one. And it was right here in Kansas. If I showed you the whole list, there'd be hundreds on there. I just highlighted some here for you to see. And in fact, right now, Centene, not even made this list, but look at Illinois, Arkansas, and Centene, 71 million. Ohio, 15 million. Mississippi and Centene, 55 million. Oklahoma, CVS Caremark, 32 million. Right now, Centene's facing a 1.2 billion dollar case. You know what? They've got the money. When you're making billions of dollars and you can write the checks, pay for your bad behavior, and keep doing what you've been doing, we have to fix that. We desperately have to fix it. So I always want to point out, this is not hyperbole. This is fact. This is all you can go out and research it, find out, PBM supplements, and it's all over the internet. It's all out. Let's jump to the next screen. This is going to be another video that I hope you all get to watch. If you sit and watch it, okay, it talks about Centene violations and it goes in.
Healthcare transparency saves lives. Yet what lies beneath the surface could shock you. Centene Corporation, a behemoth in the healthcare services industry, has faced a whopping $1,919,146,010 in penalties. These include numerous violations such as the False Claims Act, consumer protection breaches, and more. Just imagine, Centene isn't alone in this. There are other entities like pharmacy benefit managers, PBMs, whose activities remain largely unseen. What if all 50 states had the resources to dig deep, to scrutinize every action these PBMs are taking? The implications could be monumental. The potential penalties could skyrocket, exposing even greater truths. This is about more than dollars and cents. It's about accountability. It's about ensuring the system is working for the people it serves. We need transparent and accountable healthcare systems. The time to act is now. Uncovering the truth starts with a collective effort from states, officials, and you. Join the movement for a healthier, more transparent tomorrow.
Okay, and one would say, why? How are they able to get away with this? Today, PBMs enjoy, we do have about 30 other states, not Kansas. We'll talk a little bit about that. We have 30 other states who have some level of legislation that's creating transparency and requiring the PBMs to share what's going on. And I'm going to share another screen because the first thing, remember what I told you, the story you're going to hear, okay? And God bless, okay, the gentleman came up and the son works for Cigna, okay? Don't take this wrong, but if we find out, okay, that we can save money, they don't want you to know that. We have, and that's the first thing you're going to hear. Well, if you want minimum reimbursement for pharmacies here in Kansas, okay, for Kansas Medicaid, we have what we call NADAC, that's a national average drug acquisition cost. Pay us about the cost of the med plus $10.50. That study of cost to dispense was done in 2017. You think our costs went up a little bit? A lot. We're still getting $10.50, but guess what? That's better than the other PBMs. There's times PBMs were making $1.90, we're losing $100. But they're going to tell you that if you step in, or if our legislators step in, costs are going to go up. We now know that that's not true. You saw what happened with Auburn Pharmacy. Let me show you what's happened in other states right here. Okay, right here, California, 380 million in estimated taxpayer savings in the first year, with 144 million also on top of the 380 million restored to independent pharmacies through eliminations of clawbacks. So as you look through each of these, the states that have been brave enough to do it have had legislators that are not going to be on the take by the PBM to say, I'm going to step up and act on behalf of my constituents, because everybody's got to be either a taxpayer, a patient, or an employer, or an employee. Somewhere we're touched by all of that. We're all paying the tab. So look what these other states have done. Okay. So as you see, the other states that have done it, we've actually lowered costs and put money back in the hands of the providers. So we are here to take care of you. You can do both. We can save our providers and save money at the same time. Okay. Next screen. Here's the final. This is kind of a short one, I think, but here's this one. We're going to talk about what
As a fiduciary. It's more than a legal term. It's about trust and responsibility. A fiduciary is someone who has a legal and ethical duty to act in your best interest. They must be loyal, diligent, transparent, and accountable, always putting you first. Duty of loyalty, avoid conflicts of interest. Duty of care, make careful, competent decision. Transparency, full disclosure, no secrets. Accountability, legal consequences for betrayal. Now here's the twist. When it comes to your healthcare, the only clear fiduciary is your employer. They offer health benefits to attract great employees, but managing a health plan is complex. So they turn to brokers, health insurers, and PBMs, the companies that manage your drug benefits. But here's the problem. Brokers, health plans, and especially PBMs are not fiduciaries. They're not legally required to put patients or employers first. And they fought hard to keep it that way. Why? One word, money. These middlemen rake in billions through hidden deals, fees, and self-dealing, all while dodging any legal obligation to serve the people paying the bills. Think about this. Your 401k plan is protected by strict fiduciary rules under ERISA. But your healthcare plan, often a much larger expense, isn't. That's backwards. More lawsuits are popping up. But we need more than court battles. We need clear legislation that requires health plans and PBMs to act in your best interest with the same fiduciary duty that protects your retirement. It's time for change. It's time for PBMs and health plans to become fiduciaries, just like they should have been all along. Join the march to 1 million, because no one should profit from your pain. And trust should never be optional, especially when it comes to your health.
Okay, so what's important there, again, people like, why are we signing these contracts? How did we get where we're at? Well, when PBMs came on the scene, they're not an insurance company, so they didn't fall under any regulations there. They're not a healthcare provider, so they didn't fall in any, they didn't exist. And so as they grew and they grew power, they still had zero regulation, and that's really where they're at today. They want to stay there. They do not want to be regulated. They don't want to have any state oversight. They want to continue to do business as usual. Now, one would ask, Mike, why do you continue to contract with them? How's this man supposed to fill prescriptions and take care of you if I don't contract with him? And that's what I call, someone calls it a death by 1,000 cuts. Okay? I've always said we'd rather die a slow death than an immediate death. Remember, those three, if I say no to those three, 82% of all my prescriptions I can't fill, I lose 82% of our business, 82% of our patients have to go somewhere else and they can't take care of you. I've been fighting hard to try to figure out how I can stay in business and continue to sign these.
When the PBMs lose these court cases, why aren't the courts putting a cease and desist ruling along with it so that they can't then immediately after they write out the check,
That
go
is,
back and keep doing.
that's an excellent question. What he's saying is, look, when the courts, well, typically what they're doing, they're settling out of court, by the way. So that's what's happening. See, when you settle out of court, you realize you're going to lose. What do? You settle out of court, then you make the other side sign a non-disclosure agreement. You can't talk about it. Okay, we're going to write the check. We're going to go on, but now you can't talk about it. So very few of them ever get, but that's a good point. But very few ever actually, as they realize they're going to lose, they say, well, you know what, we'll settle out of court. They write the check, they move on. Nobody knows about it. Okay, but people do know about it. We have to have our legislators step up. And when we talk about a fiduciary, yes, they have no obligations to take care of the employer. They have no legal or responsible authority or responsibility. That's an issue. Okay. We're going to have about another 10, 15 minutes maybe here. Yep, got about 15 minutes. Okay, for questions. Okay, 10 minutes for questions, please.
We'll use the microphone so everybody.
Yeah.
You obviously have been on the board and trying to get changes made.
Yes, sir.
In our state of Kansas, have you gotten the ear of any of our legislators? Is there anybody in an elected position who hears what you're needing?
We do. I guess I can talk directly here. We have had a Speaker of the House for years who has said, I don't ever want to hear the phrase, he said this in public, I don't ever want to hear the phrase PBM reform. Guess what he does for a living?
PBM.
Insurance sales.
Guess what office he's running for?
Insurance commissioner.
That doesn't scare you, that just gave me goosebumps, because here we're gonna have the thought, watching the hen house. And I have left him hundreds of messages, I've had hundreds of my employees leaving messages. This man has called him on behalf of the city commission. Won't return his calls. We're due that, you're a legislator. We put you in place. He's from Sedgwick County, and I have probably 100 employees in Sedgwick County who have reached out to him personally. If you won't talk to Mayor Nate because we're not in your district, but you know what? Talk to someone who's there. Nothing. Nothing. So, yes, I've been fighting hard, but I tell you, I've learned a lot about how powerful people can be. And there are people here in Kansas. I'd say Karen Tyson, some of the others, they recognize the problem, they support us. But it's getting past the roadblocks that have been put in front of us.
And it is notable that there is wide bipartisan support for PPM reform, yet there is a single legislator that has the power to keep it from coming to a vote. And there is workarounds for that. It's just, there's not enough legislators willing to buck the speaker to get around and to bring it to a full vote. But that might be our only option this year, where it's Dan's last year in the legislature. That might be our only option, because he will almost certainly deny our bill a vote, but there will be a bill.
Okay, this gentleman I know had a, yes, further.
How does your business plan differ from Mark Cuban's cost plus drugs, which is certainly transparent?
Very, very transparent.
Cost
I've
plus
actually,
drugs is a totally transparent.
yeah, I've actually,
Where it cost plus, it gives enough for the pharmacist to make money with it.
Yep.
So how do you differ from his?
okay, I visited with Mark Cuban. How about Mark Cuban? You know why he did what he did? Because all the business he owns, he figured, he found out he'd been lied to by the PBMs. They made him mad. He has the resources to go out and try to put them out of business. The challenge with that is, it's hard to have a mail order pharmacy with only generics. You can't survive if you can only get generics in from one pharmacy. Now, I will tell you that I am contracted with Mark. My pharmacies are contracted with Mark Cuban, so that if he can get employers to sign off, but even with his power and his clout, these employers are still listening to the brokers. Remember, you got the three up here? Even he can't break through that class ceiling, but he's trying. But if he can get employers to sign on to the transparent plans, we are here as your pharmacy to help fill prescriptions for you under his plan, so that we can still take care of you face to face, and we can still be here tomorrow. Great question. Thank you for that. Okay.
So was a bill introduced, or no bill has been introduced yet? I mean, is there a bill floating out there?
We do have a bill. It's going to be introduced very, very shortly. Okay, we know we have substantial opposition. We just talked about why.
Yeah.
We also know that we have some considerable support, but they're honest with us about the control that the speaker has. So I think the more pressure that we can put on the speaker and say, we demand this. You all have a lot of power here in speak, I would certainly guess. Okay, you need to talk to them and say, you need to allow it to be heard. Let's get it out in the open and let's talk about it. We have to at least talk about it and at least hopefully bring it to a vote.
And what committee will that bill be?
We don't exactly know yet. Beverly Gossage thinks it's gonna go through hers. Beverly is from my hometown of Eudora. Had a visit with her. I testified on Friday to the Pharmaceutical Research Committee. Had a long hour talk with Beverly. She, if I can speak on her behalf, probably not fair, but she understands the problem with PBM. She does. Guess what else she does for a living?
Insurance.
Sure. Yeah, she does. She said she does Med D supplemental plans, insurance, okay, or Med D plans, Medicare supplemental. She does not believe that Kansas should get involved. She believes it's a federal issue. I think that's kicking the can down the road. I think it's doing a disservice to Kansas and all the taxpayers and all of her constituents. And I told her that. Beverly, it is not a fair market. That's where the federal government has allowed a monopoly to get in control. at the state level. Darn it, we can step in at the state level, and we can help fix it for Kansas.
The Supreme Court ruled that the states can go.
That's right. The Supreme Court even ruled that the states do have jurisdiction here.
We have about 5 minutes
Okay.
remaining, so we'll try to be as brief as possible.
And I want to get to everybody. I'll stick around for a while and talk later. Mary?
We got right, sir. Right.
Okay.
One short question, which I know you can answer. When you say broker, is that the same as the PPM?
No,
Okay, well.
No.
You don't have to go into that now. I can look that up.
okay. You will go, an employer will go to a broker and say, go shop for me. They're like your travel agent,
Uh-huh.
okay? So they're gonna go shop. They're gonna try to find you the best deals and help advise you on the best major medical plan and the best pharmacy benefit plan to bring for your employees.
Okay, now my real question is, how does this relate to 340B?
That is another 2-hour conversation that I would be glad to have because Nate and I live 340B every single day, but that is a whole separate issue than PBM reform. Okay, now in the test or in the last week, Nate's got something he's gonna want to say, but it's completely separate.
There is a little bit of overlap. When you get really deep into the weeds, there is a little overlap between PBM and 340B. The 340B issue is a Kansas Hospital Association issue at this point. Pharmacists know about it. We support 340B protections, but PBM reform, totally different. And that's what that's what pharmacists and the Kansas Farm are most, as our highest priority at this point.
One of the things that we're proposing this next term is Medicaid
Preservation.
preservation, was expansion, but now local preservation, but how do you see the proposed cuts affecting your reimbursement?
I don't see the cuts. We now have a defined reimbursement in Kansas for Medicaid. What I do see with PBM reform, the more that we get the Centenes out of the middle of Kansas Medicaid, okay? Express Scripts is also a PBM, one of the 3 PBMs for Kansas Medicaid. So if we can get them out of the middle, guess what? It frees up more money. So we don't have to keep putting as many taxpayer dollars that are just going to the PBMs, which we can still take care of the providers and actually deliver more care to those Medicaid recipients that desperately need it. You know, you don't have to talk to Nate and I about needing Medicaid expansion. I think we need it. We desperately do. So there's things we don't agree with, but the PBM reform can really be the tip of the iceberg where now we can open up. Because again, those Medicaid programs, they're all administered by who? PBMs, okay? So. Another question?
We're gonna have to end here.
Okay.
Go ahead.
Well, gentlemen, thank you very much for your time, and I know, I guess we should allow the whole afternoon just to talk about this, because there's a lot of information here. Just an FYI, my wife is the president of our hospital auxiliary in El Dorado. She listened to Mike talk about 6 months ago, I believe, in the Butler County area, down in Wichita, in that area too. And she came home and she says, you need to go talk to him. And I can see why she was excited.
Well, thank you. Very passionate, but it's my life. You patients are my life. It's what we do and it's why we're here. And you know what? We're fighting hard. We're not going away, but we need help.
We have access on computer that we can put stuff, as Sherry gets that, she can share that with us. And feel free to ask him questions and find out. I'm sure he's got a card. Gentlemen, thank you very much for your time.
Thank you all.